everyone, my name is Maggie Dancy and I will be discussing the health factors and outcomes in Essex County, New Jersey. I grew up in Glen Ridge, New Jersey, located 12 miles outside New York City. The county Essex has a collection of upper income suburban neighborhoods and lower income urban neighborhoods. These 22 municipalities make up one of the most racially diverse counties in the country. 48.9% white, 41.9% black, with 23.8% Hispanic Latino, of a population estimate of 798,975. And median household income in 2018 was $59,302. When I first saw Essex County's health ranking of 16th and 19th out of 21 counties for outcomes and factors respectively, I was surprised. I expected the ranking to be higher as the town I grew up in is a middle to upper income area. But that was narrow-minded of me. I forgot that one of the most populous urban areas in the state, Newark, is included in my county. For health outcomes, the county ranks lower than the state in premature death, poor or fair health, poor physical health days, and low birth weight. Furthermore, life expectancy is shorter by about 1 year compared to the rest of the state. There are 10 more child deaths on average in Essex County than the rest of the state. Infant mortality is 50% higher in the county, and most notably, HIV prevalence is much higher than the rest of the state. Physical and mental distress is about the same as the state, and the prevalence of type 2 diabetes is just slightly higher than that of the state. Premature death, as measured by deaths under the age of 75, has decreased between 1997 and 2007. Closer to the national and state averages. The leading causes of deaths under 75 in the county are malignant tumors, heart disease, accidents, cerebrovascular disease, and type 2 diabetes. Now moving on to health behaviors. As I mentioned, overall, Essex County is ranked 19th for health behaviors in the state. Areas Essex County is doing equally as well or better than the state average include adult smoking, access to exercise opportunities, excessive drinking, and alcohol-impaired driving deaths. Areas the county scored worse in include adult obesity, food environment index, physical inactivity, sexually transmitted infections, and teen births. Of note, not included in the overall rank, the county has high levels of deaths related to drug overdoses. The largest trends I noted in health behaviors are as follows. Adult obesity, on the left, is on the rise at the county, state, and national levels. Obesity is a national issue. However, change is possible at the county level and will be discussed later. No significant trend is measurable for Essex County physical activity between 2004 and 2016. Lastly, sexually transmitted infections are on the rise nationally and at the state levels, but rates in Essex County are marginally higher as evidenced in the graph on the right. As such a large issue for this area, I will discuss STIs and potential ways to decrease rates later. Essex County ranks 17th out of 21 for clinical care. This county scores better than New Jersey for the ratio of population to dentists and population to mental health providers. Essex County scores similarly for percentage of the population receiving mammograms and flu shots and ratio of primary care providers for the population. Furthermore, the county has a higher percent of uninsured persons and more preventable hospital stays than the average for the state. These are usually correlated as hospital stays can be prevented by primary care, which requires a form of insurance. Overall, however, the percent of uninsured persons is on the decline, but there is not great change over time in the number of preventable hospital stays. Next, Essex County ranks 20th out of 21 counties in New Jersey for social and economic factors. Essex County scores worse than the state average in every category. Rates of unemployment and impoverished children follow national and state levels. Violent crime rates in Essex County are much higher than state and national levels. The county has higher levels of homicides, firearm fatalities, and juvenile arrests compared to the state. Violent crime is decreasing but is still a large issue in the area. As mentioned previously, there is a large urban area in the county that has a history of violence. This issue will be discussed further later in the presentation. Lastly, the county scores 16th in the state for environment. Air pollution from particulate matter is the same for the county and state, and over several years has been declining. The county has more severe housing problems than the average in the state, and there are fewer driving alone to work than the average in the state. Based on all of this data, the largest issues in Essex County are obesity, sexually transmitted infections, or STIs, preventable hospital stays, and violent crimes. Obesity in Essex County can be attributed to decreased physical activity, diet, and stress. These rates could be expected to be lower because the county has no barriers to exercise and only 1% has limited access to healthy foods. To decrease obesity rates, we could increase primary care providers who could provide education on proper nutrition, decreasing alcohol consumption, and increasing exercise, which could help manage population weight. To increase primary care providers, the county would need high school teachers to support more students to obtain their degree to attend college and hopefully gain practitioners in the area. The county could also run a campaign that endorses their public spaces to foster more physical activity. Obesity is a risk factor for type 2 diabetes, heart disease, and cerebrovascular disease. By decreasing obesity rates of these diseases could decrease. And as 3 of the top 5 leading causes of death in the county, premature death rates could decrease as well. Looking at Essex County's data, sexually transmitted infections in the county may be correlated with low insurance rates and low rates of high school and college educated people. HIV rates are high in this region. Per the New Jersey Department of Health, STI cases are highest in 20 to 24-year-olds, with high rates in 15 to 19 and 25 to 34-year-olds. A possible intervention would be school health education programs via a school nurse who can discuss protection like condoms, vaccines, and transmission information. Primary care is also important for education and early intervention with infection. Access to Planned Parenthood for those who aren't insured is also very important. Next, preventable hospital stays are high in the county. Hospital stays are mainly prevented by primary prevention. These hospital stays can be due to lapse in health care for those uninsured, those with comorbidities, and those who do not see a primary care provider. By increasing primary care, patients can be healthier from the start, or illness can be caught early via routine screening. The state can help those uninsured by signing them up for Medicare and Medicaid to make sure they have appropriate care. Newark used to be one of the most dangerous cities in the country, but has been improving each year. As the most populous city in the state of New Jersey, violent crime rates are statistically higher in such areas according to the FBI. Due to the recent climate related to racial tension in our country, violence has increased in cities across the country, including Newark. New Jersey has some of the most strict gun laws in our country, and gun violence is still prevalent. A multi-sector approach is necessary to decrease violent crime. The county will need to work on housing, healthcare, equity programs, and safety initiatives. Early education is also important. New Jersey has a program called Head Start to offer early education to low-income families. Plus, supporting middle and high school programs to keep children involved can help decrease violent crimes later in life. By supporting marginalized populations and improving physical communities, violence rates can improve. My biggest takeaways are how county health varies within states, but also how much health can vary within counties. Education and primary prevention are the common themes to improve health areas that need the most help in Essex County. Education and primary prevention require funding from private sponsors and state support from our government. And the best way we can ensure we receive such support is to vote. Here are my sources. Thank you for learning about the health of Essex County with me.